All right, live on Instagram. What's going on, everybody? Got an early show for you guys. I appreciate all you guys joining me in. Welcome to official Titan Talk Tuesday at 4 p.m. with me, John, CEO of Titan Medical Center. Like I said, I appreciate all you guys joining me on this early show today. Big shout out to everybody, TikTok, Facebook, Instagram, and I'll give you guys shout outs through JJ Flam, what's going on? Claudio Batista, what's up? Kaji Gus, my dude, what's going on? M. Giselle, Cable Arm, Mark 01583, Nathia, what's going on? Sagiva, what's going on? How you doing? Strength Dad's Christian, how you doing? Montessa, J. Pat, how you doing? Kank and Vin Cook, what's going on? Kara, Moran, what's up? Everybody on TikTok, B. Hunter, everybody else joining me in there. I appreciate you guys. I got a great show for you guys. I'm sorry about the early show today. I didn't realize it until this morning. My son's got a baseball game tonight, and it's at 6:30. I got to be there for 5:30 for batting practice, and so I got to get the show in. I won't leave you guys hanging. I promise you guys. So let's get into it, man. I got some good stuff. Hey, John, how much is a fat burner shot? All right, so the best fat burning shot out there, a weight loss injectable, I think that we have, is going to be our Aries weight loss therapy, semaglutide. And semaglutide, it's a once-a-week injection, and it's very, very effective for pretty much everybody out there. There's hardly any contraindications with it. It's something you can take for a long-lasting time and have positive health effects besides just weight loss. So for this injectable therapy, it's $550 for a 10-week program. So it's very, very inexpensive. A lot of places out there are selling 1-month programs of semaglutide or Ozempic by the commercial name for $1,500. You guys are getting a 10-week program for $550. We want to make it very inexpensive for you guys, and at that point, be able to get great results out there, whoever it is, girls, guys, no matter what your age is, and how many pounds you're really trying to lose, whether it's 15, 20 pounds or it's 60, 80 pounds. This is going to be very effective, and like I said, you can take it for a long, extended period of time. What's going on? Mossy Boss, The Real Mikey Lights, Dwayne Shaw, Christina Arroyo, what's going on? Golf, Success Group. And Nathia, it's $550. There's no blood work needed. All you have to do is fill out your patient paperwork, see our medical provider. You can do that via telemedicine or come in our beautiful location, and you're able to order our Aries injectable weight loss therapy, semaglutide, and you might see it all the way through the news, all around town. It's very effective, and it works really well for everybody out there. And if you're interested, just please give us a call or text 727-389-3220. And if you guys don't know what we do, nationwide service for hormone replacement therapy for males and females, medical weight loss programs like semaglutide or ECA Stack Plus. I'm going to cover AOD 9604 today. We also do libido enhancing therapies for males and females, peptide therapies, healing peptides, weight loss peptides, sexual peptides. We also do blood work nationwide for whatever you're trying to do, in-depth blood testing, hormones, liver, kidneys, major organs, right? We also do food sensitivity allergy testing, amino acid testing. We can test all essential, non-essential amino acids. And we're here for you guys. Golf Success Group, what's going on? How you doing? Denny Solomon, what's going on? I hope all is well with you guys. Mez Polaroids, Beast and NFTs, what's going on? How you guys doing? If you guys have any questions about what therapy or any of the therapies I'm covering, or you guys want to know what could help you possibly with all these different things from gaining lean muscle mass, losing weight, feeling better inside and outside the bedroom, improving quality of life, energy levels, all that great stuff comes totally 360 with me, and I'll be able to discuss all these great things for you guys. Whew. All right, so let's get into it. How you doing, Tony? What's going on? I hope all is well. All right, so let's get into the first topic of the day because I only got like 22 minutes with you guys left. All right, so AOD 9604, Advanced Obesity Drug 9604. This is an injectable peptide therapy. We also have it in oral for patients out there, and this peptide therapy is a fragment. It's a 176 amino acid fragment of the 191 amino acids sequence that is in growth hormone. But this sequence is just a specific sequence for losing weight, for lipolysis and lipogenesis. That means destroying fat, right, that's inside the body and using food that you're intaking as energy instead of storing it as fat. So this is a great one across the board. It's got GRAS status, generally regarded as safe with the FDA, which is real nice. And this peptide you're able to do this for long extended periods of time too as well. It doesn't work as fast as semaglutide does, but it is a great therapy to utilize. And you can utilize both therapies together. You can stack a lot of our different therapies together to get expedited results. It's totally up to you and what you want to do there. But this one's a really, really good therapy. It's a peptide therapy, like I said, and it's pretty popular amongst a lot of patients. If you want to lose 5 pounds, 10 pounds, this is a good one. But like I said, semaglutide is going to be your best weight loss therapy, but AOD is up there. So if you guys are looking for a different peptide to utilize, this one's going to be the one to be able to use for weight loss. What's going on, Dan Wheeler? My man, tight, strong all day. Big guy, 45. Guam built. What's going on? John Catalania. What's going on? How you doing? Skinned by Shoddy. What's up? All right. If you guys have any questions, please shout them out to me. If you guys want to receive AOD 9604, it's a very simple and easy therapy and process to get a hold of. This one does not require blood work either. So all you have to do is fill out the new patient paperwork, and you see our medical provider via telemedicine or in person. Now, another good thing about this is a 176 sequence of a growth hormone of 191 amino acids, right? But there are some negatives if you take the whole 91 amino acids. It can cause sugar levels to rise, growth of different areas. With this therapy, you're not getting any of those negative side effects that you would get possibly with growth hormone. So that's another plus with it. And like I said, it works with the body to lipolysis and lipogenesis to destroy fat that you have inside your body stored and utilize the food that you're eating instead of storing it as fat for later on. It's really, really an amazing one. Why lose hair on TRT at 30 years old? The Pisces bartender. Good question, right? Now, if you take too much testosterone and your levels are too high and DHT goes too high, dihydrotestosterone, you could lose your hair, right? If you're predisposed to hair loss, that means your dad, your grandpa, on your mother or your father's side had hair loss. You could be a candidate to lose hair, no matter if you take testosterone or not. But like I said, you want to make sure that you're at healthy, optimal levels. Now, if you're at healthy, optimal levels and you're not going too high in testosterone, not going too high on DHT, then your levels are going to be fine. They're going to be within normal range, and you shouldn't have any hair loss, okay? But this affects different people in different ways. Now, there are other ways to keep your hair, even if you are predisposed to balding or thinning your hair. We have different therapies you can utilize to be able to keep your hair, to make sure it's thick and grow. So if you're worried about that, you know, there's something you can do for it. And the other thing about it is make sure you're getting monitored correctly on your HRT or TRT dosages and make sure blood tests are reflecting that you're okay. You might feel great, but your blood test might show a different story. If DHT is through the roof and out of control, this could lead you down the path of losing hair. So at that point, you can make sure that you prevent this too as well, like I said, with different therapies to be able to keep your hair. Also, the laser light therapy is a good one too as well. Even if you're not on therapy, to be able to keep your hair and to make it thick and to keep it to make sure you have it. So there's different types of ways out there. So if you have any more questions about it, you can call or text us at 727-389-3220. Be happy to help. Do you have any injectable bleach? No injectable bleach. Sorry. That was from TikTok. Team Stu. But I guess if you want injectable bleach, you could probably get some. Yeah, that's just a dumb question. All right, and then semaglutide makes me feel like crap. All right, so semaglutide, if taken too high of a dose, can make you very, very nauseous. Even if you're taking the recommended dose, it can kind of make you feel a little queasy. If you're getting the right therapy package along with it, like we have, we actually give something for our patients to take along with semaglutide so they don't feel the nausea or the sickness that you might be feeling. So, Brian, if you are feeling like that, there is something that you can take to make you feel a little bit better or not have that negative side effect, right? And then you want to make sure you're dosing, you're titrating the dosing, and it's doing that correctly. And you have to talk to your prescribing physician for that. You're welcome, Pisces bartender, no problem. Coach Fabio, what's going on? First, I think Rudy Marlight. Big shout to Rudy. He's doing big things out there. He's helping people and businesses gain all kinds of traction. Hopefully, I'll get to meet with Rudy here very shortly. Nalia, what's going on? Bella Soul, how you doing? All right, so let's talk about, unless you guys have any questions for me on what you guys want to do as far as your programs, let's talk about how come higher blood caffeine levels is linked to lower body fat and type 2 diabetes risk. All right, so this was a very interesting article to me. And when we talk about caffeine, we talk about high amounts causing negative side effects, whether it's cardiovascular problems or nausea or anxiety or high blood pressure. these are different things that could affect you negatively with high caffeine levels. But this study was actually done on over 9,000 participants, and these 9,000 participants actually had different types of genes. And these genes were something that were studied with these patients that had these specific genes. And these genes were genes that these patients would metabolize caffeine slower and actually have a higher level of caffeine in their blood instead of metabolizing so quick. And it's really, really crazy because with this, we talk about caffeine. It's the most consumed psychoactive substance in the world. The main source of caffeine consumption include coffee, teas, and soft drinks. And soft drinks, we could talk about, Red Bulls and energy drinks too as well. But it's pretty crazy. And, by definition, caffeine is a drug, right? And we can get hooked per se on caffeine. Now, we're not going to go rob our neighbor or, do some crazy stuff to get a hold of caffeine. But we are going to feel the effects if we drink too much caffeine over extended long periods of time and then go cold turkey on caffeine. You might feel a little down, a little inertia as far as your energy for that day. But the study on this was really, really cool. Now, one study found that the risk of type 2 diabetes decreased by 7% for each additional cup of caffeinated coffee consumed per day and 6% per cup of decaffeinated coffee per day. This is just crazy how this is because, like I said, before there was different studies showing that how high caffeine could negatively affect you, whether it was your sleep patterns at night because you were taking too many stimulants during the day and not getting proper rest. And that was leading into, this ring around the rosy Groundhog's Day where you're waking up and you're tired the next day and you don't feel like you've been refreshed and you have to do the coffee and the caffeine kick all day long to get through the day. So when I read this study, it was pretty cool. But this wasn't from people getting caffeine from food or drinks. This was somebody that had caffeine levels that were high in their blood already. So that was a difference in this. And what they basically said was that these people that had these genetic genes that were predisposed to high levels of caffeine in their blood had a smaller body mass and were at a lower risk for diabetes type 2, which is really, really kind of crazy. But it makes sense, right? And the more caffeine that these people would have at a higher level, the more calories they would burn. And that's kind of where the weight loss effect comes into play, right? When we have more calories burned that we take in per day, that's when the weight loss effect usually happens. It's calories in, calories out, and a calorie deficit. Now, not all calories are the exact same too as well, okay? So, when you're eating ice cream or you're eating a roasted chicken sandwich per se or a grilled chicken sandwich, it's a lot different as far as calories there, right? So just make sure you're limiting your caffeine, I guess, to a proper intake. Usually 400 milligrams of caffeine a day is the normal dose per use. But at this point, they were using, I think, 400 to 600 milligrams of caffeine per day. So it just depends on how caffeine really affects you. And if you are getting or you have high blood pressure, this may not be a good thing for you. So always check with your physician, right? And always monitor the effects of what you're intaking. And what do I mean by that? So even if you don't go to the doctor all the time, you can get an at-home blood pressure machine and and test yourself. Test your blood pressure throughout the day. The 3 times you want to test your blood pressure. 1, right when you wake up in the morning, before you've intaked anything, before you went to the bathroom, or right after you go to the bathroom, do your blood pressure. The next time, at lunchtime, right? Right in the middle of the day, right where you're at, and this is after you've ate, maybe 2 meals a day, you're taking in your blood pressure and seeing what's going on. The 3rd time, right before you go to bed, right before you go to sleep, you should get your blood pressure and check it right there on the spot. Do this for 1 week and see where your blood pressure is every single point in those days. And you can decide, or you can see if maybe this is affecting you negatively or not negatively, or it's affecting you positively. So at that point, you can check and monitor yourselves and make sure this is going to be okay for you, right? And if you're getting too jittery or you're getting nausea or your stomach's turning because of the intake of stimulants, lower your dose and you should feel fine until you get to that point where you feel really good natural energy or really good energy bursts. And at that point, you're not feeling like jittery or, like a crackhead per se, right? You're just all over the place. And a lot of these different things that have caffeine in them these days that people are intaking that aren't coffee or teas, like pre-workouts and such, have other different stimulants in there or things that might make you feel different. So this is not good either. So make sure you guys know exactly what you're intaking, and then you can kind of see how it's going to affect you, right? BBC 157 or TB 500, what's better, or what do you think? All right, so BBC 157 for me, I love a lot, right? I used that one initially for shoulders, golf elbow, tennis elbow, and it worked effectively for all three. Now, TB 500 can work effectively too. Joints, ligaments, tendons, muscles, and these things can work synergistically together. BBC 157 is probably going to be your winner, but you can use them both together. I would use BBC 157, and that's more site-specific too as well, where you're going to have to inject closest to the injured site. You don't have to inject directly into the injured site or tendon or muscle or ligament or whatever it may be. You just got to do it close to it. And it should work pretty effectively. And depending on what the injury is, it might take 6 to 12 weeks to fix. But it's helped me out tremendously. TB 500 is a little bit on back order right now. You can get it, but it might take 13 days to get it, just being honest with you up front. BBC 157 is going to be something you can get right away and be able to use. So that's what I would go with. I prefer BBC 157 over TB 500, but they're both tremendous healing peptides, and they both work together, and they both work apart too as well. I just think BBC 157 worked for me a little bit better. Just being honest with you guys. Victor, what's going on? Montiza, type mass. Okay, so for this, obviously semaglutide. Semaglutide is going to be the best. That's going to help with type 2 diabetes or sugar levels if you have issues there. Even if you don't have issues, it's going to help with that. Reversing insulin resistance, helping insulin work better in your body. This is a big one right there. And then after that, helping you lose weight, right? Make you feel a little bit more fuller throughout the day. Being able to choose better food sources and food types of what you really want to eat. It's expensive, unfortunately. So it is for 1 month. We do $550 for a 10-week program. So we make it more reasonable for a patient to be able to afford. And if you're really looking for weight loss, there's a lot of people out there that have tried all different things and spent exuberant amounts of money on, whether it's fad diets, fad training exercises, or fad equipment that they might have bought. And they were looking to see the results that these people were promising them. Well, with semaglutide, like I said, it's pretty much going to work for pretty much everybody across the board, and it's helped so many different people with weight loss. And then when we talk about weight loss, and even in the article I was reading about the type 2 diabetes and caffeine, when these people had weight loss from the caffeine, this helped with type 2 diabetes, and this will help with other health issues that you might have going on in the body, whether it be right then and there or in future in your life. So this is something that can help. Now, MK677 would be something I would take for muscle mass. So I do ibutamoren, and I would take the semaglutide together, and you should be able to get some great results out of this, especially if you're lifting and you're picking and choosing the right food sources. It's going to help immensely together to be able to do that, okay? What else do we got here? Any more questions across the board before I go on? If you guys got any questions, please shoot them out to me. I'll answer them right here, right on the spot. I do blood work with my doctor. Everything is good at my part. So what does your doctor test? This is a common thing that a lot of people respond to me. And I talk about blood work and how important it is. And people are like, well, I get my blood work done by my general practitioner. And I'm like, oh, that's cool. I'm like, what are you getting blood tested for? I'm like, everything. The doctor says everything. I'm testing everything. All right, so what does everything mean? It's different, I'm telling you. So a lot of general practitioners do a CMP, which is a comprehensive metabolic panel. This could have 15 tests in it right off the bat. And this could cover, it usually does, liver, kidneys, electrolytes, and at that point, those are the major ones that you're looking for in a CMP. A CBC, complete blood cell count, white blood cell count, red blood cell count, hemoglobin, hematocrit. This is going to show a doctor, hey, listen, there's an infection there, or maybe red blood cell count's high, there's something going on, and they can look into that. Other than that, they might run a cholesterol test, right? And LDL, HDL, see where good cholesterol, bad cholesterol, the ratio between it. This might be the third. Now, they might throw another blood test in there, like might be a PSA, a prostate if you're a guy, or something else for a female. But they usually don't run any of these tests. And at that point, they're not running hormone tests on you guys. They're not testing free and total testosterone levels, estradiol levels, progesterone levels, IGF-1 levels, B12 levels. These are different things that you're going to want to look at to make sure everything is okay and make sure everything is good, right? And do you know what good is? Do you know how to read your labs to a certain extent? And a lot of people don't, and that's okay. You're not supposed to. But it is pretty simple to read to a certain extent to understand. When we look at blood tests, when we look at LabCorp, Quest, whatever it is, they have reference ranges to the side. So it has your score and it has a reference range. And your score should be inside the reference range. Now, when it comes to like total testosterone levels, when you look at total testosterone levels, I'm giving LabCorp as the example. For a male, it's 264 to 916. Now, if you look at it, you say, oh, I came back 265. I'm in the middle of these two ranges. I'm good, right? well, you're probably not feeling too good because you're on the bottom of the barrel and you have low T symptoms. But from a general practitioner's standpoint, you are normal. You don't need no testosterone. Insurance company standpoint, you are not clinically deficient. You do not need this. Well, you have a libido issue, here's some Viagra. All right, cool. You got depression, here's an antidepressant of some sort. We'll see you in 30 days. Tell us how it's going, right? And you're like, man, this is not working well for me. Well, he's on one who put me on, he's the one that put me on TRT. Cypionate 200 milligrams a week. Okay, cool. So when we talk about cypionate 200 milligrams a week, that's awesome. So we're replacing testosterone that needs to be replaced or optimized. Now, on the back end of this, 2 other medications you should probably be looking into taking. One, you need an estrogen blocker. Testosterone, if you're taking 200 milligrams a week, majority of patients, I would say 90% of them, are going to aromatize. And they're going to aromatize into estrogen. No matter what, your hormones aromatize into different things. They just don't stay as testosterone. They start moving, right? And there's a cycle they start following. When we start following the cycle, we start leading down the path of 2 different hormones in particular we want to look at. One, estradiol. So this is E2. This is estrogen levels that aromatize from testosterone. And E2 is what we want to look at as males. Because E2, if that's high, right? Libido issues can happen. We can have water retention, irritability, possible gynecomastia can happen. And remember, when we have water retention, this could cause high blood pressure. This could cause headaches, issues with you that you don't want, right? When we have high blood pressure, this could affect renal issues, your kidney functions. So you don't want that. So we want to look at an estrogen blocker, or at least look at estradiol and see what's going on. The next one after that, yes, I do have a blocker as well. That's awesome. So it's probably Remedics or Nastrozole. Definitely a good choice, right? The third one, you're going to need some gonadal support. The boys downstairs, their functions and their work is shut down when you start getting testosterone from an outside source. The brain realizes, hey, listen, we have this outside source of testosterone that's coming in. Now, the signal from the brain from your testicle to your testicles, it gets shut off. Your testicles say, hey, listen, brain, we don't need to work anymore because you got it from the outside source. We're going to chill downstairs. And it's like any other muscle or anything else that goes through atrophy. It starts shrinking, and then when the shrinkage happens, you start getting low semen issues, which could cause fertility issues in the coming future. It can also affect, the look, the aesthetics of it, and it can also make tightness of the issue in the area, so it's not really good. What's with the new HRT law? They're doing it any way you can go over it. Yeah, so there definitely is, and I'm not going to discuss it on here. We were logistically set up for telemedicine with patients all over the country before the pandemic, and we've got our things put in place ready for when this laws or when they're going to do the laws in May or whatever it is. So we're not really worried about that. We've got referring physicians all around the country, so I'm not worried about that, and I've got some other things up my sleeve. So I don't really want to put it out here because I'm not going to lay the ground work for everybody out there that's trying to do HRT in my business. Hello. What about tirzepatide? Tirzepatide. That is the one I got. It's just as effective. So it is. Victor Guzman. It is very effective. Tirzepatide is another one that is supposed to be a little bit better than semaglutide as far as for weight loss and sugar levels. This one's a really, really good one too as well. Different people know semaglutide a lot more than this new one, so I talk about semaglutide a little bit more. But this will be the new big bad boy on the block that will definitely help a lot of people out there. So if you've just started this, and is this your first time taking the GLP-1s, you didn't take semaglutide before, because a lot of patients will start taking this and start getting really good results. But I want to know from you, Victor, let us know how it's going, and we'll follow the journey, man.
Also, thanks for the stars. You said 99.
Oh, thank you. I appreciate it, Victor. The stars on Facebook. If you guys see stars or you guys send stars, I really appreciate it. Badges on Instagram, I really appreciate it. This lets the algorithm know, hey, listen, we're doing a good job. We're sending you guys some good information, and you guys are liking it. So thank you so much. Whew. All right.
John just sent an email.
All right. Just quit sodas. Why am I gaining weight still? So that's a good question, right? Now, usually if you're drinking sodas, whether it's diet, whether it's regular, whatever it is, you're usually going to gain weight with these things, okay? And usually when you quit them, you usually will start losing weight. Now, if you're not losing weight, this could be something else that's going on in the diet. This could also be hormone related, okay, too as well. So you want to look at that. TikTok Addict 861. Look into hormones. Depending on what your age is, right? One, your nutritional factor. What is going on in your diet otherwise unless you stop the sodas. Start exercising. 3, start drinking a lot of water. Water will definitely aid in weight loss, I promise you. Because we don't know right now, do you have water weight that you're holding on to, or is it fat? Or do you have both? And are you holding on to the water weight because you're not drinking enough water? This can fluctuate 5 to almost 10 pounds of weight with water, depending on how much you intake or how much your body's really holding on. So this could be something you really look at. You're so welcome, Victor. Anything else I can answer for you, please let me know, okay? Lopez 10, how you doing? CMY Key, what's up? Bill 123, the only Big B, what's up? I was looking at taking Anavar with Cypionate. Is that good choice? Because I want to shred. All right, so shredding, Anavar oxandrolone really does not help you shred. All right, it's an anabolic steroid, and what it really does, and what it's really supposed to help do, is it helps you keep muscle. It helps your body from going into atrophy. You know, this is usually prescribed with burn victims that lay in beds and they can't get up and exercise. For HIV patients that are muscle wasting, these are some different things. If you really want to shred, I look at the ECA Stack Plus, I look at the semaglutide. Semaglutide is really going to help you shred. It really is. You know, oxandrolone, like I said, Anavar, it's good for hardening muscles, it's good for keeping muscle. Those are the big two effects. It's not really there to shred muscle. It doesn't help shred weight off you, right? It just doesn't help do that. So I would look into something else that's specifically for weight loss if you want to shred, okay? What else do we got here? All right, guys, I got literally like 5 minutes left. I want to cruise 200 milligrams sip SQ every 3 days. That's a little bit much. If you don't want children, though, or not using HCG. So if you use some sort of gonadal support, right? Bold 123. I recently just joined Time Medical Team. Awesome. That's great. And you guys, if you have joined, you got questions, or you got some questions on some different therapies, please shoot them out to me. So, came across any peptides for spinal cord injury recovery. What I would use is BBC 157 and TB 500. Those are going to be good for any injury as far as for healing purposes. After that, CJC 1295, you're going to want to raise IGF-1 levels. It would be a really, really good one too as well, and helping with anti-aging properties too. All right. So I think that's really about it. Let's get into the last topic. So is stealthing illegal? What to know about it? So if you guys haven't heard of stealthing, stealthing is when you're about to have sexual activity with your partner and you're a guy and you're going to have sex. And at that point, you say you're going to put on a condom, you put on a condom, and then you take off the condom before sex. If you guys are doing this out there, they're looking at making this illegal. So looking at charging people that do this, because you're going into an agreement with your partner that you're going to have safe sex, and then you knowingly remove the condom. At that point, a guy in the Netherlands did get charged for this, for stealthing, and because he had the agreement with the woman, he was going to have protective sex, and he didn't. They tried to get him on rape charges. Luckily, they didn't get him on rape charges, but they did get him on a misdemeanor that he had to pay a fine of 1,000 euros and such. So if you guys are doing this, watch out. Now in California, they try to make this illegal too, and especially for sex workers out there, because Johns were taking out off their condoms and having unprotected sex with sex workers. And I don't know if you really want to do something like that, because you're putting your health at risk, you're putting your life at risk. If you have a partner at home that you're cheating on, you're putting their health at risk and life at risk too as well. So just for you guys out there, just be safe. In all ways, shapes, and forms. And definitely don't go against what your partner doesn't want to do, because at that point, it's not consensual. You want a consensual, meeting between you two, and not an unconsensual one. So just do the right thing, guys. And, just as much as you guys are tempted, I would definitely, look at what's going to be best for your future. I have tendonitis and fluid buildup in my knee. What's good for it? BPC 157 and TB 500. Those are going to be great. Healing peptides, those two all across the way. No matter what injury you're saying, whether it's chronic, whether it's right now and this is just happening, these are the peptides, or this would definitely be the therapies that we would want to have you utilize. CJC 1295 and Naparelin is another good one too as well, but specifically for the tendonitis and the fluid buildup in your knee, those are going to be the best ones, Lopez. All right. What do you do about on-start gyno? Been with Titan for 6 years now. All right. So listen, if you've been with us for 6 years, you're starting to get gyno? Is that what's going on? Dodge, get him?
What social media is he on?
He's on TikTok. Listen, what I want you to do is I want you to call or text the line. If you're a patient and you've been with us 6 years, I want to know what's going on. Now, usually you'd be on an anti-estrogen. If you're on an anti-estrogen, you shouldn't have any issues with gyno and getting gyno. Now, if you're not taking testosterone through us and you're doing it self-medicated, then we need to start looking at something very quickly if you have an onslaught of gyno. Because once gyno happens, it's not going to go away. It's tissue that's grown in that area. If you have a flare-up right now, we could possibly help that. But we need to know what's going on. So please call or text us so we know, all right? What's good for a quadricep rupture? BPC 157 and TB 500. Anything you're talking about healing-wise, those are going to be the ones, guys, for sure, 100%. All right, guys, Titan Weekly Poll. What's the hardest part of your weight loss journey? Actually eating healthy food? 20% says that. Staying active and working out? 20% said that. People, no support around me? 30%. Staying consistent with everything? 30%. So those are the two highest. Now, the hardest part of weight loss, obviously, eating and working out. And then staying consistent, right? These are the three hardest things to do. But you need to stay consistent. And, don't really rely on somebody to support you or help you through this. I know it helps, and it might help in the beginning. But ultimately, this is your goal. You need to motivate yourself to do it. Now, if somebody motivates you in the beginning, great. They get you going. They get you on the bike, right? Now they pushed you on the bike. Now you need to start pedaling yourself. You remember learning how to ride a bike? Somebody pushed you. You fell down a couple times, but you got back up. You got on the bike. You start pedaling, then you could do it. Then once you got on a bike, it was like doing it. And you do it every single day, even if you stop for a little bit. Same thing with this. You got to be consistent. And, at that point, once you start seeing results, that usually will motivate you even more to get even more results and to keep you on track. So if you had a problem with this, listen, semaglutide is going to be the biggest one for weight loss. It's going to help you out with eating. It's going to support you, right, for sure. And then all you have to do is add the exercise, add the activity, add a little bit of sleep in there, and you're going to be good to go. And with semaglutide, if you're doing that for weight loss, or AOD 9604 you could do, or ECA Stack Plus, start picking and choosing your food sources. Prepare yourself for success instead of for failure. All right?
Love from YouTube, Eric.
All right. Hi from Alabama. How you doing? Antonio, what's going on? What amino acids are great for gallbladder, pancreas, liver? You're going to want to do glutathione. Super antioxidant, great for all those issues. Definitely. And it's something that doesn't require blood either. And will definitely help with liver. It definitely helps with internal organs. And it's great for free radicals and all these other things. Amanda, be your own support. She's got it right in the hands. And she's done it, so she knows what it takes. A lot of people do. It's just you getting into the groove and getting into the routine. It takes usually about 14 days to get in the routine. So do it every single day, and I promise you it will come very easy to you. Start planning out your days and planning for success, and don't plan for failure. That's just one thing I'm going to say to you guys all the time. All right, so I think that's it, guys. I appreciate it. Upcoming Titan events, we got 4-1 Metroflex Grand Opening in Tampa, Florida. We got 11-2 to 11-5 Olympia in 2023 in Orlando. 11-5 Festival of Speed Ritz-Carlton, Orlando. We also got Tampa Pro coming up. Hurricane Pro. We'll put those dates on there for next week so you guys got them. And I appreciate it. Thank you guys for all joining me very early for a Titan Talk Tuesday. I hope I've answered some of you guys' questions, give you guys some great information. Please join me next week, Titan Talk 6 p.m. I will be there at the right time. I promise you guys, unless we got a game, which I don't think we do. I appreciate you guys. If you guys have any questions or want to take advantage of any of the therapies, call or text us at 727-389-3220. If you want to do the paperwork, just go over the website, typemedicalcenter.com. That has all our therapies and all the other great information you can find out about what Type Medical Center can do for you. All right, guys, I appreciate you. Thank you so much. I heard someone in a book say that you can maintain normal testicular size or try by using HCG. Yes, this is true. And clomiphene's another one, or kisspeptin. And we utilize all those treatments for our patients here at Type Medical Center just for that alone. You can use it for a lot more, for fertility and weight loss and a bunch more stuff. So I appreciate it. Join me next Tuesday, 6 p.m. for more information that's going to help you guys out. Thanks.